Russia has approved a third corona vaccine. WTO chief Ngozi Okonjo-Iweala calls on Britain to distribute vaccines to other countries and not wait for the British to be vaccinated completely. And Argentina's health minister is said to have given political allies a preference for vaccinations. Now he has to give up his post. Let's start with Russia. Russia has released a third vaccine in the fight against the coronavirus. The first 120,000 doses of the Covivac vaccine should be delivered as early as next month, said Prime Minister Mikhail Mishustin in Moscow on Saturday. The active ingredient was developed at the Chumakov Research Center for Immunobiological Preparations of the Russian Academy of Sciences. According to this, 20 million cans should be produced by the end of the year. Extensive clinical studies are not yet available. According to the information based on interim result, the effectiveness should be more than 90%. The tests have not yet been completed, it said. In mid-August, Russia released Sputnik 5, the world's first corona vaccine for widespread use in the population, although important tests were still missing at the time. The active ingredient is now registered in around 30 countries. It is not yet approved in the European Union. In Russia, only a good 2.2 million people have received at least one of the two necessary injections. That corresponds to about 1.5% of the population of that huge country. There had been many criticisms of this. We are constantly increasing the pace of vaccine production, says Mishustin. More than 10 million cans of Sputnik 5 have already been manufactured. In addition, 80,000 doses of the second Russian vaccine Epivac Corona were available. According to earlier information, the active ingredient should be used in Russia next month. According to Deputy Prime Minister Tatyana Golikova, Sputnik 5 is manufactured at 7 locations. 3 more are in preparation. She demanded that even more people over 65 years of age should be protected from disease with the vaccines. So far, the 68-year-old Kremlin chief Vladimir Putin has not yet had himself vaccinated against corona. Since the beginning of the year, the number of new infections in Russia has fallen to around 12,900 on a day on Saturday. The World Trade Organization, the WTO, has now called on Britain to provide vaccines to poorer countries earlier. I think donations have to come now, and the reason is simple. It is just as much in the interests of richer as poor countries to have equal access, said the new WTO chief Ngozi Okonjo-Iweala to the BBC. At the G7 summit on Friday, the participating countries agreed to invest more in the COVAX initiative, which should give poorer countries fairer access to the vaccines. The rich countries have so far secured 2/3 of the vaccine doses, even though they only make up 16% of the world's population. Only 0.5% of vaccinations worldwide have so far taken place in the poorest countries. French President Emmanuel Macron campaigned for rich countries to deliver 4 to 5% of their vaccine doses to poorer countries as quickly as possible. Following the meeting, he also suggested that Europeans and Americans deliver 13 million doses of vaccine to African nurses as soon as possible. Chancellor Angela Merkel was basically ready to hand over some of the German vaccine contingent. The British Prime Minister Boris Johnson had previously announced the generous distribution of vaccines, but only when the British are vaccinated. In the UK, almost 17 million people have already received their first corona vaccination. And then Argentina's President Alberto Fernandez has fired his health minister following a scandal over preferential treatment for political allies in vaccinating against the coronavirus. At your express request, I am submitting my resignation as health minister, wrote the previous head of department Ginés González Garcia in a letter to the head of state published on Friday. State Secretary Carla Vizzotti is to take over the ministry, as the presidential office announced. The scandal was triggered by the pro-government journalist Horacio Verbitsky, who told a radio broadcast that after a phone call with González Garcia, he had been summoned to the Ministry of Health to be vaccinated. Due to his age, job and personal risk, it would not have been his turn yet. In total, the ex-minister is said to have reserved 3,000 vaccine doses for personal use. The powerful union boss Hugo Moyano, with excellent connections in government circles, and the demimonde is said to have been vaccinated together with his wife and 20-year-old son. In Argentina, the Russian vaccine Sputnik 5 is mainly used, and the first doses from the pharmaceutical company AstraZeneca have recently arrived. So far, just 390,000 of the nearly 45 million Argentines have been vaccinated. Since the beginning of the corona pandemic, a good 2 million people in the South American country have been shown to have been infected with the virus. 51,000 patients have died in connection with COVID-19. The World Bank plans to approve 1.6 billion by the end of March to finance vaccines in 12 poorer countries such as Bangladesh, Tunisia and Ethiopia. The World Bank President David Malpass announced to the Reuters news agency a few days ago. According to Malpass, 30 more countries will follow. The World Bank bought $12 billion worth in vaccines as part of a program and is now working with governments in poor countries to fill gaps in supplies. And a Czech request for help from Germany is getting closer. The president of the Western Karlovy Vary region, Petr Kulanek, asked about the bed capacities in the German neighboring districts in Bavaria and Saxony. They want to be prepared in the event that there are no longer enough beds in the Czech Republic to care for all COVID-19 intensive care patients. Prime Minister Andrej Babiš had so far resisted a request for help, but now he has agreed to the preparations. Just a few days ago, the Deputy Health Minister Vladimír Černý confirmed that the neighboring countries will only be asked for help when 90% of the capacities of all Czech hospitals have been exhausted. This threshold has now almost been reached. On Friday, 14% of the intensive care beds nationwide were still available. Should the hospital beds run out to care for COVID-19 patients, any inquiry would first have to be made to the Ministry of Health in Prague. This then has to decide on a request for help to Germany. The crisis plan can be activated at any time. Patients are already being transferred within the Czech Republic every day. They are sometimes transported over long distances by ambulance and rescue helicopter. In the Czech Republic, there is a stricter mask requirement in trade and traffic from Monday, so today. At least one particle filtering respirator or nanoprotective mask must be worn in shops, public transport and hospitals. Health Minister Jan Blatno announced on Friday. He recommended wearing an FFP2 or FFP3 mask. 2 surgical masks on top of each other are also allowed. On Friday, the authorities recorded 11,553 new corona cases within 24 hours. There have been more than 1.1 million confirmed infections and 18,913 deaths since the pandemic began. And we will have to cope with that for quite some time. And if you want to stay informed, please subscribe to my channel and to my other channels. I'll see you in my next video. Auf Wiedersehen.